Somebody asked here if we're having any plans on opening a place in California, and I know we're definitely expanding. Right now we have offices in California, Florida and Chicago and the Northeast, and then our Texas offices here in Dallas and in Houston. But yeah, we're going to continue to expand because the need is so great. I think there's just a lot of people realizing that there are options for their pelvic pain, and finding ways that they can treat it. So it may not be too far away.
Yeah, that's great.
I know.
I'm actually from California. Just thought I'd throw that out there.
Oh, are you? Where are you from?
The Bay Area. So
Oh,
East
nice.
Bay, California. Lived there most of my life. Only been in New York for 7 years. So
Okay.
yay, coming to
I bet you
California.
I know. Do you go visit a lot?
Not as much as I would like, but at least once or twice a year. Yeah.
Yeah. That's awesome. Every time I go visit, we love it. I lived in Phoenix for 6 years when I was doing my training and my fellowship. And, it's just such a short drive. So we would drive over there to LA or wherever for, a long weekend. And it was so nice. I really enjoyed it.
That.
Yeah. Well, maybe we'll give them like a few more minutes to join, and then we'll kind of get going. Is that okay with you?
Yeah, that's great.
Okay, perfect. And I just pulled up like our thing. Are you done with your day?
No, I always work a little bit later.
Got it. I understand that. Let's see. I had a patient, or somebody said, I had a baby less than 3 months ago, and I have stress incontinence and mild case of diastasis recti. Any recommendations? Not a lot of help here in Miami. So first of all, give yourself some grace because you're only 3 months postpartum. Like your body needs more time to recover and get back to its natural state. So that's the first thing. Pelvic floor physical therapy can be a huge asset for you without having to use any medical options. So they can help you with your diastasis. They can help you with urinary stress incontinence, especially, without Kegels. Like most of the time that's not what you need, but they can certainly help you with that. So I would get into a good pelvic floor physical therapist. Oh, and there you go. We have the office in the Miami area. So if you go in, then they can help direct you on places to find some help. All right. I guess we'll get going. Is that okay with you, Monique?
Yeah,
okay.
Great.
Excellent. So I am Dr. Rachael Haverland. I'm a surgical gynecologist here in the Dallas office, and I'm here with Monique Bogni. She's the nutritionist, our new nutritionist at the New York office. But correct me if I'm wrong, but you're also doing telehealth visits, and I know you're coordinating a lot of different care plans.
Yeah, so I'm New York based, but I'm actually 100% remote. So I can work with anybody, anywhere in the US and the world.
That is wonderful. And it's so nice. Medically, I have to have license in each state to be able to see a patient technically for a consult or a visit. And it's so nice to be able to work remote, and just because there's so many people that we need to reach that rather don't have resources to travel, or, maybe don't want to travel for an initial visit. So that's huge.
Yeah. The last few years really changed things. So
I know one good thing that came out of COVID, right?
Right.
So today we're going to talk about the nutritional impact, or how nutrition can have an impact on endometriosis. So I guess I'll just sort of let you start, and then I'll chime in every once in a while, and then at the once you kind of finish, then I can talk a little bit more about endo. Is that okay?
Yeah, that's great. Yeah.
Okay.
So as I don't know if everybody knows, but treating endo is definitely a multifaceted approach, right? It's like you get your diagnosis, and you see the physical therapist, maybe you need surgery, and you definitely want to look at diet and lifestyle, because if you think about it, everything that you've been doing up until now, right, it's not working. You're getting sicker. So it's time to look at diet and lifestyle practices and let's change them. And my approach is meeting people where they're at. So, it's really extreme to, go from, eating one thing and then total deprivation, which is diet mentality, right? We don't want to we want to get away from diet mentality. However, when you're really ill and you have really painful symptoms, we need to look at diet as a way of healing. So adopting a healing diet is what I call it. But I don't think of it as a diet. It's a lifestyle. It's a way of bringing in a whole bunch of nourishing foods and removing the foods that are not helpful. And for each person, the helpful foods are going to be a little bit different, right? You know, one person may thrive on this food, you know, maybe, for example, like with endo, I know a lot of patients feel better when they remove all grains, even the gluten-free grains. Yeah. And then there's other people that really thrive like eating a little bit of quinoa. So it's really just kind of trial and error and, you know, understanding your own body. And so that's what I help teach patients is listening to their body and understanding what foods are the best for their systems. And one thing that not everybody understands is that, you know, we all have certain levels of toxicity. And when you have pelvic symptoms, there's been studies done that you have higher levels of toxicity in your body with endo. So it's like, how can we start to pull the toxins out, like gently detoxing, right? And I'm not talking about like a week-long cleanse. It's like, how do we bring in the foods that are there? Because foods, natural foods, whole foods, fruits and vegetables can pull toxicity out and help to heal our bodies. It's just that we've gotten so far away from that. You know, with the standard American diet, it's like we're eating so much processed food that it's like we've gotten away from, you know, how we were meant to eat. And that's all. So it's like I teach almost a back to basics approach. You know, it's like, okay, let's not maybe look at all your vices just yet, but like okay, this is what you're eating. Now, how can we make that more nutrient dense? How can we bring in this? And then before long, we're crowding out the things that aren't helpful with all these really enjoyable, nourishing foods.
Yeah, I mean, that is awesome because, I mean, I have to admit, especially during residency and medical school, I did not eat well. Like, it is embarrassing what I ate. But, you know, with endometriosis, when you go through and you have this inflammatory response, and we've seen how it affects other parts of your body, right? It can affect your bowel and your bladder, you know, slight increased risk of, you know, ovarian cancer. I mean, there's all sorts of things that endometriosis can affect, and it's likely this underlying inflammatory response that it has throughout everything. I mean, I have plenty of patients, this is anecdotal, but plenty of patients with, you know, arthritis and other, you know, chronic ailments. And I think at some point they'll likely find some of these connections. And a lot of it has to do with this inflammation and this anti-inflammatory diet, you know, that's not necessarily one size fits all, which I think is really nice where they can meet you and kind of talk through the options. Because I feel like sometimes, you know, I talk to patients mostly about, you know, endometriosis excision and removing, and then this multidisciplinary approach of treatment. And when I mention these anti-inflammatory diets, and sometimes I just spout off some random things, complex carbs, you know, processed foods. I mean, it can be really overwhelming, you know, and sometimes I definitely don't want to give them this diet that you're talking about. It's more of a lifestyle change and slowly starting to implement food and different nutrition into your life so that, you know, maybe your recovery can be a little bit more smooth. Maybe you can even avoid a second surgery if, you know, there's all sorts of things there. And plus the benefits on your cardiac health and your mental health. But
yes, all of those things. Yes. Mood, and you're touching on mood and gut and the, you know, mind-body connection. Like, yes, what we eat affects everything. I mean, it makes sense, right? And so I always talk about healing from the inside out. You know, it took years and years and years to get to where you are, you know, with the conditions that you have. So it's like, it's not going to be a magic pill. It's not an overnight fix. It is. It's a journey, right? What did they say? It's a marathon, not a sprint, right? Yes. So, yeah, I mean, there's a lot people can do, and I know it's really overwhelming. You know, I've been studying nutrition for years, and there's a sea of misinformation out there. It's confusing. And then it's like, there's this diet, that diet. And then one person is like, oh, this diet is great. And the other person is like, wow, I felt really sick doing that diet. So it's like, again, you know, it's like, again, just really understanding that there's no diet that fits all. I can't say it enough because it's really just, you know, listening to your own body, your own intuition, right? And it's like there's a lot of fear now around food, especially when you have a lot of pain. It's like you become afraid to eat. And I have so much compassion for everybody that's afraid to eat. So, you know, my suggestion is it's eat simply. And then people are like, well, how do we do that? And it's really just not overcomplicating a meal. It's, you know, for example, you know, bring in 7 to 9 servings of vegetables a day. And people are like, oh my goodness, that's crazy. But let me tell you, I'm going to tell you a simple way to do that. So you take 4 cups of leafy greens, and they're, you know, loosely packed. So take 4 cups of leafy greens. That's 4 servings. You put that in a bowl as the base of your salad. And then you have a cup of steamed sweet potato. Now that's 6 servings, right? And then you've got that really great soothing fiber that we like. And another side note about sweet potatoes pull out the estrogens, and there's the estrogen dominance with the endo. So they pull out all of the synthetic estrogens. So eating a sweet potato every day could be awesome for people with endo. But so you've got your 4 cups of greens, you've got your cup of steamed or baked sweet potato, and then you've got a cup of raw veggies. Maybe it's 1/3 cup of, you know, shredded carrots, cucumbers, and, you know, tomatoes, right? So then you got another cup. Now that's 7 cups. Now the 8th cup could be a cup of cilantro parsley. Bringing in cilantro and parsley is amazing. They pull out heavy metals. They give a lot of flavor to the salad.
I think that comes from my text. I love me some cilantro. I think that's what my text
yes. I love it. Yes. So you can, so now you have like 8 cups of greens and vegetables in your salad, and you can also, so you can create a simple dressing with a little tahini, a little garlic, a little maple syrup, a little water, and it makes a creamy dressing. Or you take avocado with lemon and you smash it into this salad that you've made. So, you know, now you've got your daily allowance in this one awesome salad meal that's got like the heaviness of the sweet potato and all kinds of things that are going to like bring nourishment in. Now, the one thing I will say, I know a lot of people have compromised digestion. And in that case, you know, a salad can be, it can feel painful to digest. And it's not that your body's not able to digest it. It's just that there's a lot of sensitive nerves in there, right? Everything's inflamed. So in that case, maybe you want to start off with like a blended soup, right? Maybe you steam some vegetables and threw some vegetable broth in there, and you're steaming greens just for a few minutes to soften them, right? And then you blend them up. And so then blending things is a way of pre-digesting the food so that the nutrients are more absorbable. So, you know, and then even if you're super compromised, green juice is another great way to get in a ton of nutrition and bypass the digestion process. And, you know, maybe an evolution, or maybe it's like a little bit of everything. So these are some really simple ways that will start to help calm down inflammation and reduce pain.
I really like those options because those are things that I hate to admit this, but I'm not a cook. I mean, I'm really not a chef. I've never have been. I will throw some grilled chicken and some veggies, but it's not gourmet. But even those things are things that I can do. And especially with little amount of time, if you just spend, you know, a little bit of time at the grocery store once a week, getting all of the basics that you need, I think that that's super reasonable. So thank you for that. I have, I guess, one question that a patient told me the other day. They said, when I have like an endo flare, is there anything that I could take that's, you know, like anti-inflammatory, that's more of like a natural supplement? Or do you have any recommendations for, I mean, I realize you're talking about kind of, you know, an overall lifestyle, but if you're in a flare, or if you feel like your pain has gotten like, you know, worse over the last few days, is there anything you could recommend to kind of help soothe or calm?
Yeah, I mean, magnesium comes to mind. I mean, actually, most of us are deficient in magnesium. It's hard to get enough. And I always recommend a therapeutic dose. So it's you know, more than what the bottle recommends, right? Because, you know, you're needing more. And, you know, I like magnesium glycinate. I feel like that one's the most absorbable form, but like whatever form works. Also, there's the thermal kind. I forget the exact name of it, but you can spray it, or it's an oil. So then it gets absorbed in your tissues, and that could be really good for like rubbing on areas that are flaring with actual pain. So doing both, doing the oral supplement and then also doing the thermal magnesium. There is, I want to say it's called mineral something. I'm sorry, the name's just leaving me right now. But if you Google the thermal magnesium that you rub or spray on your skin, it'll like pop up on Amazon.
That's awesome. I mean, that's a great thing for me to remember. Like you said, just go to the basics. Like I knew that. I learned that in medical school, but there's so many things that we forget. Like we make it a little bit complicated, and truly it's not that complicated if you just sort of scale it back a little bit. But that's a great resource. So thank you for that. I'll have to remember that when my patients call or message me. But, anyways, So I guess now I'll talk a little bit about endo. We'll kind of go into endo, and then we'll come back and talk a little bit more diet. Is that okay?
Sure, great.
Okay, so I was just going to give a little bit of endometriosis education. I mean, endo is very complex. It's multifactorial in the way that it affects your body, and it affects you and your overall wellness. But one thing that the first question is just, what is endo and how does it happen? So endometriosis is cells similar to the lining of the uterus, stroma and glands that live elsewhere in the body. Rather, it's in your pelvis, is the most common place, but it can also be, I mean, on your diaphragm. It can be in your lungs. I mean, there's case series of it being in your brain, which is very, very rare, but it's certainly possible. And so these lesions outside of where they belong tend to they cause pain. So they get inflamed. They do feed sometimes off of estrogen and progesterone, but there's some studies that say they show their own or make their own estrogen. So it doesn't matter if, you know, we take out your ovaries and put you on Lupron, you know, you can still have pain from endometriosis. So endometriosis research is certainly, it's hot right now, and it should be, because there needs to be more research in these areas. And endometriosis affects 1 in like 10 to 11 women. It's almost as common as breast cancer. So breast cancer is 1 in 8. Endo is 1 in 10. I mean, that's crazy. It's crazy that we don't have more resources for them, like non-hormonal treatment. And so we're starting to learn more about endometriosis. But the way I try to explain it to somebody that doesn't have endometriosis, or maybe they have a wife or a partner or a family member that has endometriosis, it's like an ulcer that you get in your mouth. Like it bothers you. If you rub your tongue over it, it hurts. If you eat salty food, it hurts. And you look inside your mouth and there's just this tiny little white spot. But it hurts really bad. It's this open ulcer that's just causing havoc in your mouth. And that's sort of how I explain endometriosis in the pelvis. It doesn't have to be stage 4 endo to have debilitating symptoms, but these ulcerated lesions of endo are all over the pelvis. I mean, they can affect your bladder with you know, urinary frequency and urgency. They can affect intercourse. They can make you have painful intercourse, especially if the endometriosis is on the uterosacral ligaments, which tend to kind of stretch with deep intercourse, and that can be one of the reasons why you have pain. Can certainly lead to constipation if it's around the bowel or in that posterior cul-de-sac. Pain with bowel movements. I have some patients that have more of a diarrhea symptoms when they're on their cycle, just because of all the inflammation. Sorry, can you guys still hear me? Okay.
Yeah.
Inflammation from their cycle, which just inflames all areas. But the most common place for endometriosis first is on the ovaries with endometriomas or ovarian cysts. And then the second most common place is those uterosacral ligaments. But truly it can be anywhere in the body. And then I guess we kind of went through the causes of endometriosis, but to be completely honest, we don't know. Like, we need more research to know, where does endometriosis come from? Why is it there? And then maybe if we can sort of learn that, we'll be able to find ways to avoid it or make it less common in the future. But we think it likely is there from birth. I mean, there's certainly a genetic component. If you have a first-degree relative, like a mom or a sister with endometriosis, you're 10 times more likely to have endo, which is crazy. It's not 10% more, 10 times more likely. So if your mother had endo, if your sisters have endo, when you come in and I talk to them, get their history, those are light bulbs going off. Like, they have confirmed endo. I always tell my patients, just believe yourself, like, trust yourself. These symptoms are not normal. But there's certainly a genetic component, a family history. We think that it likely spreads sort of with lymphovascular invasion, almost similar to cancer and how it spreads, or it's just deposited from the very beginning when you're being formed. I mean, even from the womb, a lot of times it doesn't show up until you get to like your first age of menstruation, but there are case reports of younger women, even before their cycles, having endometriosis. I certainly see postmenopausal endometriosis all the time. Like, it is not that uncommon to do an excision of endometriosis and find postmenopausal endometriosis. So it doesn't always have to go with your cycle. Unfortunately, there is some, there's differing theories, right? But one that can sometimes be harmful to women is that retrograde menstruation. Like, endometriosis comes from blood during your cycle spilling out through your fallopian tubes, and that can be dangerous because it cuts out those women before they have cycles, and it also cuts out women that are, you know, postmenopausal. It also leads to the theory that if you have a hysterectomy, it should cure your endometriosis, which is certainly not the case. You know, the best treatment we have for endometriosis is excising the tissue. So surgically going in and removing the tissue, not a hysterectomy. I mean, most of the time I don't do hysterectomies in my patients. You know, certainly if they have adenomyosis or another etiology of their pain, that's a discussion. But endometriosis excision does not have to do with removing the uterus. It's removing all of the lesions. And it's important to just be very thorough. I mean, when I do surgery, I look at the diaphragm first. I look at the liver edge. I look at the gallbladder. I look at the diaphragm on the other side. I run the small intestine. I look at the appendix. I look at the colon. And I do all this before I even look at the pelvis, because I get too excited. You know, everybody wants to look at the pelvis, but you have to make sure that you're not missing anything. And if you're not thorough, then what's the point of surgery if you leave something behind, or if you're not excising all the lesions? Even if you leave a small amount behind, it has a higher chance that it will recur and continue to grow, and they'll have to have another surgery down the road. So one of the things that I talk about with surgery is do it once and do it right. I like to I look at everything. I'm very thorough. If it's scar tissue, if there's scarred lesions, if it's inflammatory tissue, endometriosis, I want to remove it all. And most of the time I do this with organ preservation. A lot of my patients are infertility patients. I see them because they're rather referred for me for their infertility doctor, or they haven't been able to get pregnant for multiple years. And I can remove the endometriosis without affecting your fertility negatively down the road. There's actually a lot of literature that says endometriosis excision does improve your fertility because it gets rid of all that inflammation in the pelvis. Embryos and sperm, well, embryos, eggs, and sperm are very finicky. They want a perfect environment. And if there's inflammation in the pelvis, even if it's not on the tube itself or on the ovary itself, still causes just an inflammatory environment. And so that's a lot of reason why the egg and sperm don't fertilize to make an embryo, or the embryo doesn't implant in the uterus because of this surrounding inflammation. So the next question is, why is endometriosis so painful? And I think I kind of went by that a little bit, but endo is so difficult to understand. I mean, I have patients with stage 1 endometriosis that are just debilitated before surgery. And then I have patients with stage 4 endometriosis that are quite functional. And there's not a correlation with the amount of disease and the symptoms. And that's why I talk about endometriosis just being this ulcerated lesion. I think some of it has to do with where it's located. If it's an area that the uterus kind of sits on, or if it's near the rectum every time you have a bowel movement, or if it's near your bladder. But all of these organs sit very close together. And I know during surgery you see them spread apart, but that's because the patient's kind of tipped up on their head a little bit, and there's gas that's insufflating the abdomen, but they all live right next to each other. And so the bladder affects the uterus, affects the colon. They all work together. And so endometriosis is painful because of this inflammatory response, and because of this just kind of ulcerated characters that they have. Sometimes treatments are using hormonal medications to help the symptoms, and it can help, but it's not a treatment for the underlying cause. So that's something that we're starting to try to get away from. It's not an absolute, but using medications like Lupron can affect your fertility down the road. They can cause osteoporosis, not to mention all the mental health side effects that they have by putting a young woman in a menopausal state. But we're trying to get away from using those medications and more towards just treating the underlying cause, so that once the underlying cause is treated, then you can start to see improvement and progression with diet, with physical therapy, with physiatry, with nerve injections. But sometimes without getting rid of the underlying cause, you're only going to improve so much. You're not going to get to your goal of a better quality of life. So I don't know if that's a good answer for why endo causes pain, but that's the best I have for now.
Well, I just want to say I loved hearing how thorough you are and how passionate you are about your surgical procedure. And I was just thinking, wow, gosh, if I had endo, I would definitely want you to operate on me.
Well, thank you.
So I appreciate your dedication and your passion. It's so important. And something you said resonated with me. So you were talking about genetic, like you'll see a family have endo. So one of my theories, based on everything that I've researched, is that we can also we can pass on toxicity through utero. So, you know, it kind of makes sense if we, you know, we're eating the same thing as our parents, we're eating the same thing as our sibling, we're living in the same type of environment, right?
Yes.
It makes sense that there could be things that are passed down that are causing everybody to have these symptoms, right? So one thing I talk about in our basically is our flagship nutrition program here at Pelvic Rehabilitation. It's called Nourishing Foods to Help Heal Your Pelvic Pain. So one of the things I've talked about in the very first class is toxic exposure and how we get so toxic, right? So you know, one of those ways is through food, right? So not only is conventional crops sprayed heavily with proven to be cancer causing, you know, herbicides, pesticides, just really toxic chemicals. But it's also, we're getting toxic chemicals. They're allowed in our skincare products. You know, they're in smelly candles or scented candles. Things like Febreze or plugins, anything that has a perfume, you want to get rid of those immediately. Those are, you are ingesting toxins that way. So it's like, even just, even getting unscented laundry detergent and soaps is really, really important. Anything that has a beautiful color that's blue or pink, not made in nature, you want the clear. And then this may be something that people may just not have thought about it up until, you know, they may have got a diagnosis, but like the tampons and pads that you're using, they have to be organic. Absolutely. You're putting something inside you, or so close to where you're having the main part of inflammation in your body. You definitely want it, because non-organic, you know, pads and tampons, they're sprayed heavily with chemicals. So, you know, and of course, eating organic is a really great way to, you know, reduce toxic exposure. And then if you're reducing, you know, the more whole foods, organic whole foods you're including, you're going to reduce the processed foods in your diet. And then you'll, you know, and that's one strategy, right? That's, so all of the things I mentioned, just, you know, and it's not overnight. It's like, oh my God, I have to now get rid of all my makeup. I have to get rid of all my soaps. Like, no, just like pick one thing. And then there's an awesome website called Environmental Working Group, so ewg.org. They actually put out the Clean 15 and Dirty Dozen list every year. So if you're new to shopping organic, it's a great place to start. It's a free guide that they give you and tell you like the cleanest items that you can buy conventional. And then there's the items that you definitely want to buy organic, because they have the most toxic exposure.
For you, kind of.
What's that?
For you, so you can just go there and kind of know your options.
Exactly. So they have other lists like the cleanest sunscreen. So it's just learning what ingredients are, you know, are chemicals. And there's a lot of ingredients in packaged food. And actually last night, so I was live at the 4th class last night, and I did a show and tell of all my favorite products, like, you know, healthier crackers and like healthier dips and whatever. So I, you know, one of the things I teach is if it has more than 10 ingredients, put it back on the shelf, because it's probably not food, or probably has a lot of chemical toxic ingredients in it. So, you know, they're sneaky the way they're written on labels, but you know, it's definitely possible to include some fun foods, so some fun packaged foods, you know, along with a whole foods diet.
Yeah, I mean, that is awesome, and it's so nice to have those resources. So when you do your like your classes, tell me, like, how many sessions are there? Like, is it a group session, or is it one-on-one? Just to tell kind of our audience, I guess.
Yeah, so it's they're group programs, so anybody can join, and we're actually probably going to move towards it being self-paced, because I've been recording them, and a lot of people find that, you know, maybe the time doesn't work for them, or they show up but they really enjoy being able to watch it 2 and 3 times. So I really find that just having it be self-paced, and then still having access to me. So people will email me with any questions after they go through the information, after they watch it. I've gotten really good feedback. Everybody's just like, wow, this is just so informative. You know, and then I do a recipe demonstration at the end of most of the classes, you know, that kind of ties in everything that we've talked about. So it's like, for me, I mean, I'm a very visual person. It's like, you can tell me how to do something all day long, but, you know, once you show me, it's like, oh yeah, that's so easy. So I love showing people, this is, you know, this is how you include the healthy stuff I'm telling you about.
Yeah, that is awesome. And how I learned too. I mean, I'm certainly very visual, but sometimes I need this structure to just say, you know, once a week, I'm going to sit down and I'm going to spend some time taking care of myself, whether that's meeting with you and going over healthy foods, or if that's meditating, or if that's, you know, going to physical therapy, whatever it is. I need that structure. I'm one that'll, you know, I kind of get scatterbrained a little bit. I'm type A, but I just don't spend time on myself. And I feel like that's where a lot of our patients are, especially women. They tend to take care of everyone else. Whether it's their kids or their sisters or their parents, they don't put themselves as a priority. They used to be in pain for so long, or, you know, they've been dealing with this. So it's kind of a chronic condition that they don't necessarily know if they're going, like, this may be their baseline. But, you know, one thing that I want to tell patients and anybody listening is that there are options to improve your quality of life. Like, this chronic disease, this chronic pain that you have, whether it's endometriosis, you know, pelvic floor dysfunction, you know, nerve issues, you don't have to stay where you are. Like, that's one great thing that PRM has to offer, is that there are so many resources. And that's one of the reasons I was drawn, you know, to work with them and to work with you, is because I wanted patients to have these options, to know that multidisciplinary approach is certainly the best way. That's where you're going to have the best outcomes. Surgery is not always, you know, 100% cure, because your muscles and your nerves have been in pain for so long. There's that central sensitization of pain. You know, the clean eating certainly can help with that inflammatory response, both before surgery, but especially after surgery, just helping surgery have, you know, the best outcome. Because if we can calm those nerves and calm the inflammation in the pelvis, working with physical therapy and nutrition, I mean, your quality of life can significantly improve. And
absolutely.
It's really nice to know that that there's options for patients. And I think a lot of times they've seen so many physicians and so many providers that they, you know, they haven't gotten any better, that they just feel kind of defeated. Like, this is just going to be their baseline. And it's really not. And that's one thing that's just awesome about PRM, whether it's, you know, working with you, the nutritionist, or, you know, some of our classes to go through, you know, surviving pelvic pain, you know, with our PhDs, and just, you know, seeing physiatry before and after surgery. There's just, and, you know, we have good rapport with our pelvic floor PTs, literally in almost every city. I mean, I have patients fly in to see me from all over the country, and it is amazing, the resources. They're like, oh, there's this PT I met at the Endometriosis Summit, and she is good with, like, she does good pelvic floor PT, and she lives in the city. We're going to refer. I mean, it's amazing, all the resources. So even if you're not in one of our hubs, you know, you can telehealth, or you can, you know, you can telehealth, you know, for a lot of different things. PT, probably need to be seen. Surgery, or like at some point you have to be seen, but there's still, you know, a lot of options there.
Yeah, well, and I think that what you mentioned about self-care, and that's where, you know, we talk about lifestyle. It's like, I've talked to a lot of patients who are just really defeated by the time they're ready to talk about food. They're just exhausted. It's like, oh, now I've got to change my diet. It's like, it's like, but it's going to help you, and I'm going to help you make it fun. So, you know, maybe maybe it's speaking to everybody out there, you're not in a place where you want to follow along a course and absorb information. So let's have a one-on-one session, and you know, I can support. So I support people individually, you know, and I usually like to meet with people for 3 to 6 months, because again, these changes don't happen overnight. It's like I'm your cheerleader, and I'm there holding your hand and taking you along the changes. I'm here when questions come up, and when it's like, you know, I don't know what to eat. It's like, I'm going to help you figure out what to eat. Now, I'm not going to tell you what to eat. I'm going to help you figure out what you're going to eat, right? Because it's different for everybody. So I know sometimes people, they're just like, just tell me what to eat. It's like, okay, well, let's talk about what foods make you feel good. So we can, you know, so it's like it's a team effort between me and the patient. Now with the courses, it's, you know, it's overall approach of, you know, this is going to help reduce inflammation for everybody, right? We're going to reduce toxicity. We're going to bring in nourishing foods. And then if anybody's looking for more individual support, then we can meet one-on-one and, you know, and go even further, right? So, yeah, I definitely, absolutely, like everything you said before, at any point in the process, addressing, you know, what you eat is so very important and can help, you know, reduce endo flare-ups. It can, you know, and it can reduce your endo pain. So
I know it's worth it. I mean, that's something else that, you know, I try to hit home with patients. It is worth taking the time and the commitment to take care of yourself, because you can't take care of anybody else if you can't take care of, like, if you're not
put your oxygen mask on first.
Yes, exactly. And it's so true. And it's not an overnight thing. And I like that, you know, talking through, you've been in pain. I mean, most of my patients have been in pain since they started their menstrual cycle, you know, at 12 or 13. I mean, and some of them are 20, but some of them are 35 or 40, and they've been dealing with this for so long. So it's not, you know, an instant turnaround. And I think, you know, getting rid of the underlying endo certainly helps, but just retraining your brain and your mind, not just with nerve pain, but also, you know, with food. What does make them feel content? What foods do make them happy? What, you know,
exactly.
Working through that post-operative course. And I think that's a good time to start making changes too, is when you realize, oh, I'm starting to feel a little bit better. This is getting a little bit better. Why don't I see nutrition and start like working through that? And then once they realize, I've never felt this good in my life, and I didn't even know it was possible. I mean, it's very cool how diet can completely change or just your whole overall being. And it's tough. It's not easy. I mean, it's definitely not an easy task, but I think the way that you approach it, it's not a fad diet. It's not like a juice cleanse for 4 days and then you can go back to what you want to do. I mean, that's
doesn't work. It's not sustainable. Well, and I will say, you know, for probably the first, I don't know, 10 or 15 years of my cycle, like I had debilitating periods where it was like I'd have to call out sick to work. I'd, you know, be doubled over all day. So I know what that can be like. And when I discovered, you know, when I understood how to detox the body naturally with food and like which ones to remove and which ones to bring in, I remember it was like a miracle. I'm like, oh my goodness, I thought that was normal, right? And I know that everybody thinks that pain is normal and it's kind of marketed out in, you know, the world as being normal, and it's not, and it can be pain-free. So yes, my heart goes out to everybody that's in pain, but we're here for you.
Yeah, we are. And we have lots of resources. I will say I've had 1 or 2 patients in my short career that have been able to completely change their diet. I mean, they're young, they were in high school. So as you can imagine, high school students don't necessarily, you know, eat the best, but she had a brother that was very into nutrition. She sought care with a nutritionist. She completely changed her lifestyle. She started exercising where she was not exercising. She started, you know, eating clean and healthy. And her brother would essentially help her make her meals. He's like, this is what I'm eating. I want you to eat. And I've had very few, but a few patients in my career who made a drastic change over time, not immediate, and were able to get off all of their medications. They did not have surgery with me. They did do pelvic floor physical therapy, but, you know, the less invasive measures. And it was, I mean, it's amazing how much effect food has on the body. And I mean, anybody can do it. If these 8-year-old women can do it, anybody can do it. You just have to be really dedicated.
Yes. Oh, I love that. I love hearing that, because I mean, I believe that. I wholeheartedly believe that the food is medicine, you know, or the slowest form of poison.
Yeah.
So,
Yeah.
I mean,
yeah. It is, it's kind of incredible how that happens. But, you know, going back to the young women, that's one of the things that I'm really trying to advocate for here at PRM and just overall is women getting help earlier identification of disease. Painful periods, debilitating periods, missing school, missing work is not normal. You know, inability to have penetrative intercourse without significant pain, you know, is not normal. There are lots of resources, but I'm trying to advocate to catch and identify women earlier, and treat them earlier, because if we can treat them earlier, less long-term effects, less risk that endometriosis affects their fertility, less risk that, you know, they have that, you know, as much to reverse, right? When you've been in pain for 20 years, it takes a long time to reverse. So if we could catch them early, you know, some of those changes may be a little bit easier, like for the central nervous system and for their myofascial, you know, tension. But just talking to women and listening to young women, especially, because the younger you are, the less likely you are to be heard or taken seriously. But painful periods are not normal. Like you shouldn't be missing school and work and unable to go have dinner with your friends or, you know, go to your soccer game with pain. And so one of the things is, you know, we can treat young women. We can start to influence them younger, even if it's not, you know, surgery, but certainly with diet. Anybody can, you know, focus on their diet, pelvic floor physical therapy, just trying to catch and identify women that may be at a higher risk for endometriosis or these, you know, chronic pelvic pain symptoms earlier so that they don't have as much debilitating, you know, effects down the road.
Well, and that's a really good message to spread. Painful periods is not normal. It's a red flag. So right? So because like even I just thought it was normal, you know. But fortunately for me, I did catch it early, right? I think I'd be very sick today had I not changed my diet, you know, so many years ago. But it was the diet change and you know, bringing in self-care, whatever kind of relaxation exercises work. Like, you know, for some people it's meditation, for some people it's just sitting there in deep breathing. You know, for some people it's going on a walk, for some people it's like exercise or it's yoga, it's Epsom salt baths, it's just standing on the grass outside your house, going to a park. It's important that we take time out during the day. Because all of these other things are important, but also it's like calming the nervous system, right? Because being in pain for so many years, there's trauma in that. So it's, you know, and I know that Doc says that in her Retrain Your Pelvic Brain course. So yeah, it is. It's just, it's taking care of yourself and listening, you know, what is the pain telling you? It's telling you that it wants to heal.
Yeah. And it's wrong. I mean, that's what
something's wrong. Exactly.
Telling you that you need to, like, that you need to act, that something has to change.
Right.
I took that Retrain Your Pelvis when it comes to endometriosis with Dr. Millspot, and she is amazing. It was a wonderful resource. I was disappointed only in that I hadn't had that resource for my patients for the last 5-10 years. I mean, it was really nice. Preoperative, you know, management, post-operative management with some natural remedies, things to think about before surgery, things that don't even have to do with surgery. But it was so nice that women are validated. Like we understand that endometriosis is very common, that it's very real, and that there are options. And that's what Dr. Millspa does when she goes through this course. And it is just an awesome research. I try to have all of my surgical patients take it, but even if they're, you know, not a surgical candidate, just taking this course with Dr. Millspa and understanding how endometriosis works, understanding how it's affecting your body, and just giving your courses by giving your patients this knowledge to change their nutrition.
Yeah, I love it.
I know. Is there any questions that we didn't address? I was looking through. let's see. We talked about, kind of the different courses that patients can take to meet with you, but they also can meet with you one-on-one. So to do the nutrition courses, you don't have to be a patient of a PRM. Is that correct? Or you do need to be?
Correct. No, okay. You do not need to be a patient. The courses are for everybody. So maybe it's your introduction into PRM, right? So I actually think we do have some new patients that have come through the course. But yeah, and so, I'm going to keep making more courses. There's another one coming soon, Creating a Healthy Gut. It's going to complement the Nourishing Your Pelvic Pain course. Yeah. And it's just, because we also know that especially with endo, that, they call it endo belly. Like we have to, the gut needs, the gut needs some love.
Endo belly. And I don't even love that term, but it is so real. I mean, I get pictures all the time. And they're like, I look pregnant, or somebody told me at the grocery store, that I looked pregnant, and it changes so rapidly with that inflammation and that swelling. It is very impressive.
Yeah. So again, it's going back to removing the inflammatory foods. They're going to help calm everything down and remove, the unhelpful pathogens that are in there that are causing all of the bloat and all of the, IBS and stuff. So, in the Creating a Healthy Gut course, it's like we just focus on, the gut a little bit more,
Which I say at least 30% of my patients have GI symptoms. I mean, rather they have endometriosis on their bowel, or they have, chronic diarrhea, constipation, pain with bowel movements. I mean, I think that is a really good resource for my patients. And it might even be higher than 30. I'm just throwing out a percentage, but a lot of women, when I talk to them about, all of their endo symptoms, I mean, plenty of times I get GI symptoms. And also many times they've been and worked up with GI doctors, scoped from the top to the bottom.
Right.
Rather just given a random diagnosis because they don't know what's going on, or just there's nothing wrong with them. But that's certainly not the case. Like, I listen to your body, know that there's something wrong, and then hopefully you find the resources to sort of plug you in to where you can get some help.
Yeah. Cat here. He's like, hello. It is. It's the multidisciplinary approach, like we keep talking about. It's like, it's not one thing that's going to help you get better. It's all the things. It's seeing all the practitioners. It's bringing in the self-care and really putting yourself first for a change, because it's, how can we help anybody else if we're depleted, if we're suffering? So it's like, what can we do to support ourselves, and then we can be there for everybody else too.
Yeah, I agree. It is so worth it for your health. I mean, your health is worth it. I cannot reiterate that enough. And it is long-term. A lot of our patients are young. They have their whole lives ahead of them. And if you make changes now by putting yourself first, by trying to find, resources and treatment for your pain, by changing your lifestyle and your diet, rather, with exercise, I mean, your quality of life your future can be so different. And it is really important to just put yourself first. I'm sort of speaking to myself, but I'm sort of speaking to the people that are listening, but it is so important. Like, I just can't reiterate that enough, especially when you see and find resources that can help. Just keep working through, because it's not going to be an overnight change. But, if you look back in 6 months or even a year from where you started, hopefully you see that drastic change, even if you don't see it, every day or every week.
Right. I mean, well, and even for me, like exercise, that's an area where it's like, it's difficult for me to be consistent. It's like, I get an A++ in the eating part, but then it's like, oh, okay, no, it's like, oh, I didn't really do anything this week. But I notice when I do work out consistently, whatever that is, whether it's like yoga or bouncing on my trampoline or going for a walk, right? And it doesn't have to be complicated, right? I feel better. I have more energy. I feel more clarity. I just feel better. So I know for me, the motivation to get exercise is because it's just going to make me feel better mentally and emotionally.
For sure. I mean, I was reading a study the other night as I was putting a PowerPoint together that one of the most common symptoms of endometriosis is fatigue, which is
Yeah.
It's so non-specific, but I think it's because your body is just combating all of this inflammation.
Yes.
It's not giving you energy for your daily functioning.
I agree.
But just
yeah.
push through, making yourself exercise even though you have that fatigue or you're not sleeping well, making yourself change some of those dietary habits.
Right.
I think slowly you can see changes, which is really nice.
Absolutely. I mean, I've seen people feel, it's incredible. They just start drinking water the first thing they wake up instead of drinking coffee, and bringing in water. Well, it's a lot of people do. They just wake up and have their coffee, but bringing in just 2 cups of water first thing, over 2 weeks, they're like, I feel so good. So even just the tiniest changes can make such a big difference in your life.
Yeah. And well, that's why it's so nice to have you and have your resources, is because some people don't even know that that could be an option for them, or that, you know, that is something that they could do, or even should do.
Right. Right.
You know, they drink coffee in the morning, a Coke at lunch, and then, you know, I don't know, they may not even be getting, you know, adequate water intake. So, I mean, that's great. And I'm so glad that we have you as a resource for patients. I think it'd be really, really nice. Nice to have that you're so accessible with not only your classes, but also your one-on-one treatment. I think it's going to be really nice.
Oh, thank you. Yeah, I'm excited to be here. I'm excited. I've met some patients so far, and it's so nice to get to connect with all the doctors this way. This is so fun.
I mean, when I was looking to join PRM, I was like, it is just so, again, I can't reiterate how nice it is to have these resources for patients. And I don't have to look far because they're just right here. And it is so nice. Everybody is, you know, we use evidence-based care, which I think is the #1 priority for any medical office, is not just doing things willy-nilly, but going it based on the evidence, seeing like actual outcomes. And it's wonderful because that's how patients, you know, get better, and you see them, you know, every other week in the office, rather than seeing Dr. Kapadia with physiatry, or they're seeing me, or, you know, I get an email from their PT, or, you know, follow up that they actually signed up for the courses that I recommended. And it's so wonderful to see these patients progress and see some of their changes.
That we can address. We really can, you know, address their symptoms from so many different ways, where instead of having to go, you know, to doctor after doctor, or, you know, practitioner after practitioner, it's like we have everything they need right here at PRN.
I know the multidisciplinary approach is so important. I mean, it really is a holistic approach with how we're looking at the patient. We're truly treating them as a whole. And I'm a surgeon, so people like to think that I'm not holistic, but I am. It's very important to have all of these people looking at you emotionally and mentally, looking at your diet, looking at your nerves, looking at your muscles, treating you as a whole, as a person, like understanding that there's a lot more to, you know, you than pelvic pain. Like pelvic pain does not define you, and there's ways to, you know, to kind of get around that.
Absolutely. Well, are there any questions in the comments that we need to answer? I don't know are you seeing anything?
Let's see. Anybody? I saw one above talking about pudendal neuralgia. Yeah, that one's going to be tough with the pudendal neuralgia. Really the MRI, but make sure you're seeing somebody that really, really knows. You know, I would recommend seeing physiatry, really, or somebody that really knows their nerves of the pelvis. The neuropelvology is very complex. Sometimes MRIs can see it, sometimes they can't. But I think probably seeing a physiatrist that really works with a lot of pudendal neuralgia patients may be a good first step, just to make sure that you're getting diagnosed appropriately, but also knowing all of your options for treatment. But I think that's the only one. I didn't see any other questions. Anybody else have questions? I'm sorry if I missed them.
Well, this was so wonderful. I hope we get to do it again soon.
Thank you so much for taking time out of your day to meet with me and letting me get on Instagram and share all of our, knowledge and passions about endo.
Yeah.
Very cool.
Well, have a wonderful evening. And yeah, well, are you Pacific time or Mountain time? What time is it?
Time. So I'm just, you know.
Oh, it's afternoon.
Yeah, 4:54. So we're kind of closing up the end of the day, but it was a good day.
Yeah, it was. Awesome. Well, take care, Dr. Haverland.
Yeah, and thank you so much. It's really nice to see with you and talk to you about all of your resources. Have a good day.
You too. Bye.